If you have been struggling with your weight, cravings, blood sugars, cholesterol, and gut health, then you'll want to stay tuned because I will be talking about one of my favorite supplements called Berberine. This is a supplement that I recommend quite frequently, and it has so many benefits. And in this video, I'm going to go over where Berberine comes from, why it works, what conditions it's good for, who should not take it, and then you'll want to stay tuned till the end because I will be going over which forms of Berberine to take so that you can make sure you're getting the optimal effect from your supplement. Hi, I'm Dr. Var, and it is my mission to help you understand the underlying root cause of your chronic medical conditions and give you strategies to help you reclaim your health. So let's dive in. What is berberine? Berberine comes from a plant called Berberis vulgaris. And we call it an alkaloid compound, which is basically a natural plant chemical that has effects in the body. How does berberine work? There are several different mechanisms, and so I'll go through each one at a time. The first way is it activates an enzyme called AMPK. And AMPK is like your metabolism switcher oner. So it basically helps your body run its metabolism much more efficiently. And this is a particular way that it may help with blood sugar control and insulin resistance. When you turn on AMPK, it tells your body to make less glucose. So normally your liver is making glucose, especially if it's under certain conditions where there may be a higher glucose demand. However, when you're insulin resistant, and then of course when you're pre-diabetic and diabetic, this liver production of glucose may be pretty constant. And this is why it's so hard to control your blood sugars. But if AMPK is turned on, then it tells your liver to not make so much glucose. They have done studies comparing berberine with metformin and have found that it can be as effective. When you turn on AMPK, this also tells your muscles to take more glucose in, which is a good thing because it is taking glucose out of your bloodstream, so it'll lower your blood sugars. And then it gives fuel to your muscles, so your muscles have more energy. And because you're always using your muscles, you're actually able to burn off that glucose instead of it staying around in your bloodstream, causing damage to other tissues and organs that may not necessarily need it. The other thing that happens as berberine activates AMPK is that AMPK makes you burn fat more efficiently, and it actually turns on your fat burning. It'll also decrease the chance that excess sugar or glucose will be turned into fat cells. And then over time, with the blood sugar control and the improved fat burning, it actually may help with weight loss because of these changes. The second thing that berberine does is that it helps lower your cholesterol by reducing a protein called PCK9. Now you may have heard of a medicine called Repatha or Proluent. These are the every 2-week injectable medicines that actually block the production of PCSK9, and hence they are called PCSK9 inhibitors. Well, berberine also can do the same thing. So PCSK9 is a protein that blocks the ability of your body to clear your bad cholesterol from your bloodstream. So by blocking that enzyme, your body's allowed to absorb the cholesterol, process it, and get rid of it. Berberine also helps reduce the amount of triglycerides that are made by the liver. So it can also help improve the triglyceride component of your lipid panel. Here's some bonus functions of berberine. It can balance your gut microbiome. It also has antimicrobial and anti-yeast effects. So if you have candida infection or you have something called small intestinal bacterial overgrowth or intestinal methanogen overgrowth, then it can be used to help improve these conditions. Now, because berberine does have antimicrobial properties, if you do take it, you want to take a break after you take it for about 8 to 12 weeks so that it doesn't throw off your microbiome in another way. All right, so who should take berberine? Now, be sure you check with your healthcare provider, though, to make sure that berberine is okay for you because it can interact with certain medical conditions and medications. So if you have insulin resistance or metabolic syndrome, high cholesterol, high blood sugar, then berberine may be an option for you. You do want to be careful though, because if you do tend to have hypoglycemia, then adding berberine, because it can lower your blood sugars, may also increase the risk for hypoglycemia. If you are insulin resistant and have high insulin levels, then eventually berberine will help reverse this, because some people have hypoglycemia because their insulin levels are high, but berberine will help insulin resistance. Over the long run, it'll actually help balance your sugars. But still, if you are having hypoglycemia, then you definitely want to get with your doctor and have them monitor you closely and monitor to make sure that if you are having symptoms, that you start maybe even at a lower dose, or it may not be the supplement for you and you may have to try something else. If you have PCOS, you tend to have insulin resistant with it, so berberine may help improve that and also as a result help improve fertility. And then if you have gut health issues, especially if you have infections called SIBO or intestinal methanogen overgrowth or candida, berberine can help get rid of those infections. Now, who should not take berberine? If you are pregnant, you do not want to take berberine because berberine can cross the placenta and it can cause uterine contractions, which can increase your risk for a miscarriage. So definitely if you're pregnant, stay away from berberine. If you are breastfeeding, berberine can cross into the breast milk. So if you are breastfeeding, you definitely want to stay away from berberine as well. If you're on certain medications such as insulin, sulfonylureas, and even metformin, because those tend to lower your blood sugars, and especially the insulin and the sulfonylureas tend to have a risk of hypoglycemia on their own. If you add berberine to it, then you want to make sure you watch your blood sugars closely, and if you get any hypoglycemic symptoms, you definitely want to work with your healthcare provider to lower the dosages of the other meds or take you off the supplements. Berberine also uses enzymes that a lot of common medications use for metabolism. So what that means is that berberine can either make other medications more effective or less effective if that particular medication also uses the same enzyme. A lot of healthcare providers now also have pharmacists that they work with, so if they don't know, they can check with the pharmacist who can look it up and make sure it doesn't interact with your other medication. If you have a history of gallstones, you definitely want to be careful and be under the care of your doctor, because berberine can stimulate bile flow, which may increase the risk of having more symptoms if you do have gallstones. All right, now we're going to go over the dosages to take, how to take it, and which forms are the best to take. So berberine, when you take it, it's not the best as far as being orally absorbed, which means that it may not get into your system where it can be effective. But there are certain forms that are better bioavailable, which means they are better absorbed and are more effective. So these are berberine HCl, and then there also is another form called berberine phytosome, which is even better absorbed than the HCl form. So you may not even have to use as high of a dose. But typically, I will start with just 500 milligrams in the evening, because berberine can cause some GI symptoms initially. So you don't want to take a huge whopper dose at a time, because then you might get some nausea or GI symptoms. So typically I'll start at 500 milligrams once a day for a week. If people are doing fine, then I will increase it by another 500 in the morning. And so then they'll be taking it twice a day, and then the next week I'll add another 500 at night, and then the following another 500 in the morning. So you're taking up to about 1,000 twice a day. Now, if people can't tolerate that high of a dose, then I'll go back down to whatever minimal dose that they can take it. I've had a few that just really couldn't tolerate it, and we just stopped it. So it is important that you do dose berberine several times a day, because it does have a short half-life. So you want to get the effect to last in the evening, then you want to take it in the morning and evening. And there are some people that even will dose it 3 times a day. So just work with your healthcare provider to find the right dosing. If you do have some gut sensitivity from even the 500, there are some companies that make a lower dose of 250. You also want to make sure that you take it with food that helps it absorb better and get into your system. And then just like with any supplement or even medication, you also want to include lifestyle changes, because it's not a magic pill. You still have to make sure that you are having a healthy lifestyle, staying active, getting better sleep, because berberine only focuses on some ways that your body relies on for good health. So it's just one tool, but it's not everything. So I mentioned the two forms that I like, Berberine HCl and the Berberine Phytosome, but let me just go into further detail about that. So the Berberine HCl is the one form that has been the most studied, and the Berberine is bound to HCl, and so that gives it more stability and better absorption. It's been the most studied as far as the clinical research that's out there, and it's effective for gut health, blood sugar control, cholesterol control, and indirectly may help with weight loss. And as I mentioned, I typically will start with 500 milligrams and then work the way up to about 1,000 milligrams twice a day. Sometimes you may need higher doses than that, and sometimes you may need it dosed 3 times a day, but work with your healthcare provider on that. And then the Berberine Phytosome form is berberine that's bound to fatty acid, and it may actually absorb 5 times better than some of the other forms of berberine. So you may actually just need a lower dose. You may not have to take as much as you do with the hydrochloride form. It also tends to have less risk of gut symptoms. So sometimes if you've tried the berberine hydrochloride form and it bothered your gut and you couldn't take it, you might want to give the phytosome version a try because you might be better tolerated because it's in that fatty acid. So a typical dose is about 550 milligrams. You could start with once a day and then increase it to twice a day. And then there are some other forms too that may be effective. There's berberine that's with silymarin, which is also called milk thistle. So this may be good if you also need some liver detoxing components. Milk thistle may help with that. So there are berberine complex or blends. These are ones you have to be careful with because they have other supplements in them to combine with the berberine. So whatever it's combined with, you just want to make sure that that other substance is something that you actually may need and that won't harm you. So you want to work with your healthcare provider on that. So I'm just curious, have you ever tried berberine? And if you did, which form did you try? And did it help you? I'm always curious to see how it works, especially for blood sugar control and cholesterol and even weight management. And if you are trying it even for cognition, definitely let me know. The research is still out on that. They've only done animal studies as far as I know and as far as the timing of this video, but that's very exciting if that helps. And it may work by reducing inflammation because when you reduce inflammation, you reduce all chronic disease, in my opinion. If this video was helpful, please like it so I know that these are the kind of topics that you want to hear about because my goal is to help you and help you understand your root causes of chronic medical conditions. And don't forget to subscribe. Have a fantastic day.